So this is a person you've seen unconscious.
Okay.
If you don't know anything, it's a roadside person who
Okay.
at home also.
Okay.
So what you need to see, before approaching the patient, see the scene.
Okay.
So is the scene safe for me to go and rescue, and is the scene safe for him to go and rescue? Like in a water or middle of the road, it's not safe for both of us.
Right.
So we bring him to the safety, make him lie down. Okay.
Okay.
So now what do is we do a check. Okay.
Okay.
Hello sir. Hello. This is how you call him.
Okay.
So 2 times. Hello sir. Are you awake? Are you okay?
Okay.
So if you know the name, you call by the name. Otherwise, hello sir, hello madam, or whatever in Telugu also you can whatever. So now after checking that, you know that he is not responding to you.
Okay.
He is unconscious totally. So now you have to check the pulse and breathing. So how will you check the pulse? So I just for demonstration purposes I am lifting it here. We have a nipple line here and the midline here in the neck. Okay. Where we do compressions is here with the junction of nipple line and the midline. This is where we do the compressions. But where do we check the pulse is here. See, if you see your Adam's apple here, sir, you do palpate Adam's apple. Okay. So now slide it to the left or right. In the first dip, put your 2 fingers like this and then press.
Yeah, I'm able to find my pulse.
Okay. Now that you have checked on the one side, check on the other side, sir.
Okay.
Can you do it?
Yeah.
Same way in the patient also you will have to identify the Adam's apple here and then slide first dip, go and press with the 2 fingers.
Okay.
Understand? So now don't go very back here, you will not be able to see. So it's just beside the Adam's apple here. Okay. So now I use both the hands very wisely here because we are running out of time for the patient. So now my 2 hands on when I am on the right side of the patient, I use my left hand to check the pulse. I will use my right hand to put on the chest or the abdomen to see if it is moving for breathing.
Okay.
So like if I am putting myself, if I am breathing, my hand will move like this.
Right.
So like that, if the patient, if you put a hand like this, it will move up and down if he is breathing. So I will check the pulse and the breathing at the same time for about 5 to 10 seconds, just like this. 1, 2, 3, 4, 5, 6, 7, 8. I am not able to check the pulse.
Okay.
I don't feel a pulse, or the patient doesn't have a pulse. These 2 scenarios, you can directly go and start the CPR. But before going this, you will have, there is another very important step called calling for help, sir.
Okay.
So no one should forget this. So once you identify the patient is unconscious, the second you do that, you have to ask, please go call for help. Like if you are there beside me, sir, please call ambulance.
Ambulance. Okay.
108 or nearby whatever the ambulance is there, nearby whatever is there, please call for help. So the minute you do say that, there is a way to asking for help. So you call for ambulance and you will tell exact location where you are. So the road, the landmark, so that they can, what is the route to come to that particular place and how to go about from that particular
place. Maybe we can share the location as well.
Yeah, that is if it is very difficult for them, we can share the location. It's very easy now because of the smartphones.
Right.
So, but 108 sharing location will be little difficult.
Okay.
What you do is you should tell them the landmark first, so that they'll identify which ambulance is nearby that one and they'll dispatch. Once the ambulance is where, that person will call you. Then that is when you can share the location to them. Okay. Yeah. So in that way, you can call the ambulance. The minute the ambulance is called, then again you should come back to the patient. If you are alone, not any person, so that is your job to call for the ambulance and then do the things simultaneously.
Okay. Yeah.
Okay. So that's
maybe switch on the phone, keep on the speaker and do both things simultaneously.
Yes. If you have a Bluetooth or something, yes, you can speak over the Bluetooth. It's very easy. Or you can put like this and then you can do, that is easy. Okay. So once you know how to do things, it's very easy to how conveniently you can perform that person. So now that we have known that there is no pulse and there is no breathing, you already call for the help. The next step and important step would be doing chest compressions. As I told you, CPR means Cardiopulmonary Resuscitation. So cardio is restarting the heart, pulmo is restarting the breathing. Resuscitation is giving a life again by restarting. Okay. So now, as I told you, where do I do compressions? It's a nipple line in the midline of the patient. So I use my hand like this, dominant hand. My dominant hand should be like this. Put my fingers like this, and the non-dominant hand will come and close my fingers like this. And then you should be perpendicular to the patient. That means my have to be straight to the patient, not like this or like this or like this. Your knees, elbow should not bend, it should be straight. So like this. So, okay, now I can do the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I can go for the breathing. So I'll demonstrate you the breathing after this compression. So why don't you try once?
Yeah, so this is my dominant hand, so I keep this in front and I will keep my non-dominant hand like this, and I will ensure my elbow is not bent, so I need to
Little more bending onto the patient, sir,
Okay.
perpendicular, and the elbow should be straight.
Both
This is
the
the
elbows
perfect
should be
position.
straight.
Yes, this is the perfect position. Yes,
Okay.
sir. Do.
1, 2, 3, 4, 5, 6, 7, 8, 9.
See,
10,
the what
11,
you should
12,
remember is
13,
the force
14,
should not come from the
16,
shoulders,
17,
from the
18,
elbows, but
19,
from the
20,
shoulders,
21,
and your back
23,
should be
24,
moving.
26, 27,
Your weight
28,
should be
29,
falling on the
30.
hands rather than only the back moving. Okay, that is more important.
Okay.
Okay, otherwise you will get a backache later on. So otherwise it's very important that your weight of the body will fall on the patient rather than you pressing the patient. You should not use any muscles as such. The weight should do the work.
Okay.
Okay, so now that you have done the compressions, we will do how to do the breathing. So ideally the breathing would be mouth to mouth, but if it your loved ones or if it you are at home, someone who you care about, yes, you can directly go and do the mouth to mouth. I'll just show you how to do a mouth to mouth. Okay, so first thing is you have to pinch the nose of the patient,
Okay.
and you have to seal your mouth around that person's mouth like a normal breath. Don't take a deep breath. Don't do that, like a normal breath. And then seal and then blow slowly. Don't do. Example, if you take a full glass of water and blow it, what will happen, sir? It will spill on you. If it is a hot coffee, how will you do?
Okay.
So it's just like that. So it's okay. That means just a small blow, release of your air into the other person's mouth. So that, and when you are doing that, you have to see from the corner of your eye, you have to see the chest. It will slowly raise. Like this.
Okay.
So that means it is a successful breath.
Breathing.
Okay. So when you do that, you have to open the airway. When you know that airway and foot pipe both are side by side.
Right. Yeah.
And they have a connection in between like this. Okay. So now to make the airway straight, you have to tilt the head like this.
Okay.
Like this. So you have to hold the chin and lift it.
Okay.
So you lift it and then tilt the head. So this is called chin lift and head tilt.
Okay.
Okay. Chin lift and head tilt. Okay. So now can you see this mannequin? Just like this. In this way, like if you are smelling something, you do like this. Why you do like this? Because you are opening your airway.
Right.
You are taking the breath. So that is the reason you have to do chin lift and head tilt. Close the pinch the nose, and then if you are afraid to do that, you can put your hold like this. You can even do that.
Okay.
But there should be a perfect seal. If there is a seal, the air doesn't escape from outside. If there is no seal, the air escapes. So whatever you give will not be going into the patient. Okay, that is how you give the breaths. So you give 2 breaths, sir.
Okay.
And you see the chest is rising.
Okay.
Okay, now one set of compressions, 30 compressions, one set of 2 breaths. It's called 1 cycle.
Okay.
So you do that for 5 cycles.
Okay.
You should be able to finish this in about 20 to 30 seconds.
Okay.
So usually the speed of compression should be 100 to 120 compressions per minute. That means in a second you should be able to do 2 compressions.
Okay.
That is the speed. Even the breath you have to give it in within 2 to 3 seconds.
Okay.
So once you give 5 seconds of this one, 5 seconds of this one, you will take a gap of about 5 to 10 seconds again.
Okay.
In that 5 to 10 seconds, if with both are there, now I have done the compressions. I will come to the head end and you will come to the chest compressions and you will do the compressions.
Okay.
We will change because there is a thing called compressor fatigability. That means when I am doing compressions for more than 2 minutes, I usually get tired.
Okay.
I may not know it, but my strength of compressions will definitely come down.
Okay.
So that's the reason it's called exchange.
Okay.
So compressors will get exchanged and then the other person will do the compressions, then I will do check and breathing in that particular minute.
Okay.
Okay.
Yeah.
So that means you have to change your position for the compressors for every 2 minutes or 5 cycles.
Okay.
So whichever is earlier. Or if I am tired, then immediately I have to ask, okay, I am tired, why don't you go ahead? It's not about numbers here, so it's about giving quality compressions and breathing.
Okay.
That's what we are doing here. So the minute you do here, every 2 minutes you stop and change yourself, you check your breathing and pulse at the same time. So like I did earlier, you have to do this like this every 2 minutes. So once if you get the pulse, that means you have achieved what is called return of spontaneous circulation. That means return of pulse. Return of pulse where the patient can start breathing, may not be able to start breathing. So if he is able to breathe, leave him like that and wait for the ambulance. If he is not breathing, but pulse is there, definite pulse is there, then only support the breathing like I told. Every 5 to 6 seconds, one breath, we can keep on giving him until the ambulance arrives, and every 2 minutes you keep on checking both pulse and breathing every time. So this cycle will go on, like 2 minute cycle will go on, you have to remember that, and then every time you check both pulse and breathing has to be checked. So if pulse is there, breathing is not there, support the breathing. If pulse is not there, breathing is not, support both of them by compressions and breathing. So in this way your CPR is actually complete.
Sir, I have one question. Why do we pinch the nose? Can you explain?
Yes, see, as I told you, the minute we are blowing, air has a very tendency to escape through holes.
Right.
Okay, so wherever there is a leakage, air escapes. So if you don't pinch the nose, the air escapes through the nose.
Okay.
Whatever you are blowing, it will come out through the nose.
Okay.
So which we don't want.
Yeah.
We want the air to go in. So that is the reason we tilt the head, lift the chin, pinch the nose, put a tight seal, and then do it. As you asked earlier, doubt, if it is a roadside person who don't know, who might be having infection or anything, we don't know what it. So post COVID, it is a recommendation to give a breath. We can give it through a barrier. You can use a handkerchief, or you can use a small plastic pipe and you can seal it up and down here with 2 hands, and then probably you can blow.
Okay.
Or you can see it's Indian jugaad.
Right.
You know whatever you want to do, you can do. But ideally, it is to be done mouth to mouth or mouth to mask.
Okay.
Any other doubts, sir, in this?
No, sir. I think everything is clear. So now everyone who sees this video are ready to give a CPR.
Yes,
In a
and
perfect
always try to practice on a mannequin whenever this. We did a recent camp. We have good attendance, sir. Everyone learned how to do it, and they were very happy on doing it. So this mannequin is available with us. Whenever they want to come, they can come practice here and they can go.
Yeah.
So that we can do in that way. So because learning first aid CPR saves a life. Unfortunately, if you remember, our president, beloved President Abdul Kalam sir, has collapsed on the stage, but none on the
Right,
stage
right.
has done CPR there. If they would have performed, probably would have still had him here now.
Right.
So that is the importance of learning CPR. Every person should know this. Every person who sees this video, please try to learn it and then teach to many other people, so that this is a very basic skill. Basic skill like drinking water, like cooking, eating food. It's a basic skill. So you have to do this, then only everything will fall in place.
Yeah. Thank you, sir.